everyone, I'm Dr. Tanuja H, Consultant Obstetrician and Gynecologist at Cloud9 Chinagar. What is preconception counseling? Preconception counseling is seeing a doctor whenever you're planning for pregnancy. Why is the preconception counseling so important? It is to see if you are healthy enough to carry on the pregnancy, to see if you have any medical disorders like anemia, hypertension, blood pressures, hypertension, thyroid disorders or diabetes, to know when is the fertile period pertaining to your own cycles, to know if you have any PCOS, to start folic acid, that's 5 mg, which is available over the counter to avoid neural tube defects in the forming fetus, as well as to have a healthy pregnancy. Ideally, folic acid has to be started 2 to 3 months prior to pregnancy. What are the things a doctor would advise when you see the doctor for a preconception counseling? Is to blood test and a scan. Blood tests like CBC to check for anemia, RBS to check for sugars, the TSH to see if there are any thyroid disorders, vitamin D levels, and also the rubella and varicella status. Rubella and varicella status are needed to see if you are immune or not. So, because if rubella and varicella infection happens after conception, it can cause lethal anomalies in the fetus. So, hence termination may be required. So, if we know the immune status prior in hand, if the vaccine is required, vaccine can be given prior to conception. All these blood tests need to be done so that a lady before conception can be treated for all the disorders prior in hand, so that she can have a healthy conception, healthy pregnancy. You need to get an ultrasound done to see the abdominal organs, if they are fine or not fine, especially the uterus and ovaries. If you are having any chronic illnesses like hypertension, diabetes or epilepsy, and if you are on medication for it, the medications need to be changed, which is safer in pregnancy before planning for pregnancy. What is all needed prior to conceiving? You need to have a healthy diet with lots of vegetables, greens and fruits. You need to avoid fatty food, have a low carb diet, exercise regularly. Exercising makes one manage the weight, which helps with ovulation and also helps conception. There is a myth saying that exercising should be stopped when you're planning for a pregnancy. No, as I told, it's a myth. Exercising actually helps with ovulation, hence it has to be done till the date you turn positive for pregnancy. Yoga and meditation, which will relieve stress and hence help in the ovulation. Most important but not the least is if the couple are smokers or alcoholics, you need to quit smoking and alcohol, because smoking whether passive or active can be dangerous at the same level. And it can harm the sperm motility, it can harm the sperm quality, as well as it can harm the egg quality. So people, please stop smoking and alcohol before you plan for a pregnancy. And the most important thing, folic acid has to be regularly taken 2 to 3 months prior to conception.